Is there anything coming up that makes you excited about the future for a real deal 20-year cure, whether it's gene editing or a medication that's in the works? Do you believe in 20 years we're going to have a real deal cure?
I'm not sure that we'll be at the point of cure. We might be. I was hoping we'd be there by now, but of course, I got a little overly optimistic about that 20 years ago when we first started really looking closely at the genetics of ADHD. I think on the horizon, in the near term, first of all, we're going to have better diagnosis because we're going to have better instruments, such as the way we apply AI to neuroimaging. Because the neuroimages that we see in the ADHD brain are very disrupted, but they're subtle. And it's going to take very sophisticated, I think, technology to be able to tease that out to the point where it's reliable and valid enough to use for diagnosis. We don't have that right now. Don't go get brain imaging or SPECT scanning or anything that people may offer you that's just not useful. And it's the same with genetic testing. There are sites right now that will gladly do genetic testing and tell you if you have ADHD genes. Those are not reliable. We just don't know enough about the genetics of ADHD to say that, here are the 3, 4, or 5 genes. At this point, it looks like it's going to be anywhere from
Wow.
25 to 45 different gene sites in the DNA. But the hope, down the road is that perhaps within the next decade, with all the research, because genetics is the fastest moving area of research right now for us, we may have genetic testing. We may be able to subtype people based on the different genetic architecture that they have. We may be able to predict drug responding, which we cannot do right now, even though some people think we can. We cannot do that right now. So, improved diagnosis, improved prediction about drug responding, maybe even improved drugs for ADHD. Once we know these genes and we know what they do in the brain, it might suggest a different kind of medication for some types of ADHD. We're learning that GABA, for instance, is another aspect involved in ADHD, unlike dopamine and norepinephrine that the traditional drugs are affecting. So, can we find some kind of medication that works on the GABA system? And there'll be more like that as well. I'm just sort of simplifying it. So those are near-term goals. And then, of course, with CRISPR and the other gene editing technologies that we have, once we've lined up the suite of genes that we think is contributing to risk for ADHD, then it might be possible to take, egg and sperm that may contain some of these genes that we've identified and re-edit them to remove them. But here again, we want to be a little careful about that because, we don't want to be trying to genetically engineer the perfect individual, even though some parents would like to do that. A lot of the things that have contributed to our culture come from people who are not neurotypical. So we don't want to get down to this very homogenized human where we're doing CRISPR technology to edit out genes that create this wonderful variation in human personality and human thinking that these genes are contributing to. But I think in the meantime, better drugs, better diagnosis will be something I think that we can look for.